Hi, everyone. My name is Dr. Rachel Bussman, and I'm a clinical psychologist at the Child Mind Institute. We are a national nonprofit that supports children and families with gold standard mental health care advice and resources, all online and accessible to everyone. We're here for you wherever you are with expert telehealth resources, including diagnosis and treatment of mental health and learning disorders, group programs for anxiety, mood disorders, ADHD, and more, remote neuropsychological testing or evaluations. Please visit childmind.org/telehealth to learn more. Before we jump in, I just want to say with protests over the violent deaths of Black Americans dominating the news, it's understandable that many people and kids are feeling scared, confused, or angry about the situation. We're all thinking about racism and violence and how to raise caring children and talk to them about what's happening in our society. We're happy to answer your questions about parenting challenges related to this, and please do visit our website for resources specific to the topic. Today, we're talking about summer planning, and we're talking about summer planning and tips for parents specific to anxiety. So before we get started, I'm just going to remind you that if you're tuning in, you can type your question right now or at any point during the stream, and I'll do my best to answer your questions. We also collect our questions so that we can try to answer them later, and we are recording. So if you have a family member or a friend you want to send this to about summer planning, please do feel free. I've already written some questions down that we have, so you can go ahead and think of your questions and type them in as we get started. So the first question I think is kind of where a lot of people might be thinking, which is, where do I even start when I think about the summer? And I think it's a really valid and very understandable, certainly relatable experience for me. I think something that's a challenge is that we're all in different parts of the country and world. So some of us have been on summer vacation already for a couple of weeks, whereas my son, I'm in New York, so my son still has school for several more weeks. And then added to that, independent schools run on different schedules. So basically everyone's starting at just different times. So you might feel a little stressed about that, but just know that your summer is coming, and it's never too early to plan ahead. So I think when we think about where to start, it might be helpful as a parent or caregiver to step back and say, what do we typically do during the summer? And maybe I'm someone who likes to make lists. I like to make lists. It's helpful to see things visually. And I think it's helpful to say, what are some of the things that are typical in my summer? And then look at that and then see what things are going to be part of my summer this summer, or what things do I maybe need to adapt. Hi from the UK. Hi from the UK. So I don't know if they're on summer vacation yet. I think not yet, but you can tell me if you are. So I think it's helpful, I hope, when I on these try to relate my own experience. So for me, my son goes to sleepaway camp. And so for a while, and he goes for 7 weeks away to New Hampshire. So for a while we were sort of in limbo, not sure if it was going to happen, not sure if it wasn't. I had actually presented a little bit before this pandemic happened around anxiety and sleepaway camp, or anxiety in camp. So you can imagine that the COVID situation just adds another layer. Our sleepaway camp ultimately decided not to run for a variety of reasons. And they actually said pretty clearly they felt they could run as safe as possible, but the guidelines from the American Camp Association and some CDC really are obviously giving a lot of guidelines around safety and health and transportation and what they're calling pods of kids, that our camp and many other summer camps felt like they didn't feel like, to the spirit of going to sleepaway camp, they felt that they could align with that. I practiced something called radical acceptance, which is a fancy way of saying tolerating the message and not necessarily liking it. So I actually was able to say, is this my most favorite thing to hear? No, it's not. And we'll get through this for sure. One, I feel very privileged and lucky that my son can go to sleepaway camp and he's safe and healthy. Knock wood, we are. So we're going to make it work. Hi to Ireland. So that was then off the table. So I could take that off the list of things I need to think about, which actually helped me. I guess I tried to see silver lining because I didn't have to fill out a lot of medical forms for camp, and I didn't have to go and get certain things. Then it opened it up for what do I want to do? So a big question some families have asked is, can I send my child to day camp? And that, I think, is not a question. If you're expecting me to give you an answer, I can't give you one. What I can say is that different camps have really different guidelines. Different camps have different sizes. So my son also, when he was a day camper, attended a camp of about 900 campers. So if some of you are thinking, holy moly, how would you send a child to a camp with 900 campers? We're thinking the same thing. However, that camp specifically put out about a 40-page document, really well done, of all the different measures they are going to do to actually open safely. Now, my guess is many campers won't be attending this year. So there's a normal attrition because many families aren't in the city or things like that. So I think the question, if you're wondering, can I send my child to day camp? I think the first question is it on your list of a maybe situation? And if it is, then you probably need to do a bit of research, which actually means that you want to look at the camp's website, look at what guidelines they're going to be following, and read those documents, right? They may be a little overwhelming, but I actually think that being forewarned is prepared. So being prepared for what it will be like will help you best decide if day camp is something that's right for you. Similarly, again, I'm kind of relating this to myself, but my son does some art classes and he usually takes them in person after school. They've been offering them via Zoom since March. And I will admit that I was a little, not pessimistic, I was a little skeptical about how my son would take a cartooning class on Zoom. I mean, to me, I guess I was being very narrow. And so I'm being transparent just to say that anybody can learn to be more flexible. So I was thinking, how are you going to learn and sit and draw when that's really something you do in person? But with the technology of screen sharing and using, he has a pencil and paper. We're not talking about very high tech materials here, but his teacher is using Zoom and able to screen share and gallery view of the kids, and they're all interacting, and it's actually gone great. My point is that some summer programs are offering a virtual option only for activities. Some are actually offering a hybrid, or I guess hybrid is probably a combination of in-person and virtual, but this particular summer program for this art place, you can choose to attend remotely or in person, depending on your comfort. And what I kind of like about that is they're limiting it in person to just 4 kids, which is very small, and using plexiglass dividers and other safety measures. But if you want to do it virtually and you just don't feel comfortable, that's cool too. So what I would say is, no matter where you are in the country or abroad, you want to look at town options, private options, school-based options, the Y, your church, your temple, lots of different range of experiences, range of fees. I've also seen something sort of interesting and kind of cool on social media. I'm on some Facebook parenting groups in the town that I live in, and I have some parents or not parents, actually, young adults posting and saying like, hi, my name is Travis. I was going to be a sleepaway camp counselor this summer for a bunch of boys at X camp. Camp's not happening this year, but I can come to your home and do a camp option for you in your backyard. I charge X amount an hour, and I can basically do, I don't want to call it babysitting because it sounds a lot more than that to me, but a lot of camp counselors aren't going to camp. And so they might be home in your town and maybe willing or able to organize a scavenger hunt for an hour with your child and maybe a neighbor's child at a social distance. So I think this is where creativity is really key. So again, you can type in your questions if you want at any point. I love the comments too. Another question is, my child doesn't want to go outside. I fear that the virus has gotten her really scared. She used to love to do things like biking and swimming, and now she doesn't want to go out at all. Do you have any advice? So yes, I do. I would say it is not. So one of the things is that if we don't practice something, we tend to get a little rusty, right? Now, there's, of course, the phrase, you learn to ride a bike and you always know how to do it. being someone who's, I'm really good on a stationary bike, but not so much on the one that rides on the road, I feel like actually things need to be sort of practiced, right? So if your child hasn't been going outside for a while and she's nervous or he's nervous and feeling really anxious, then their brave muscles haven't been practiced either. And so that's where, depending on the child and their age, having a really just open conversation with them. Jackson, I noticed that when I say let's play outside, you're telling me no. What's up? And then your child is invited to have a conversation with you. And maybe they're worried about getting sick. Maybe they're not worried about getting sick. Maybe they just feel like they haven't done it for so long, and they're maybe worried they won't like it anymore, or they're worried they won't be able to do it. The truth is, kids think about all different kinds of things. So the first thing we want to do is have a conversation with them. Then I think it's to move to bravery practice, right? So you might say, okay, I would love for you to ride your bike around the neighborhood. I feel like, these streets are fine. I would love for you to swim. If the person has a pool, or to wherever pool that you go. And I'd love for you to play a lawn game or play a game outside our front step of our apartment. Which of those things do you think would be the easiest? And maybe start there. And maybe pair that with just some good old fashioned praise for bravery, and maybe even identify a reward. So I think that a lot of times avoidance leads to feeling like, well, thank goodness I stayed inside. That's better for me, right? I'll also say that when kids really avoid doing any activities or are really withdrawing, we want to watch that carefully, right? That, coupled with a change in mood or sleep or appetite, really could signal that maybe something else more serious is wrong. So you just want to watch that, make sure your child's not getting depressed, and really reach out for telehealth services if you need it, right? So again, not that I'm causing the alarm bells ringing, but you want to kind of look at that along with mood, sleep, and behavior. So we have a really great question coming in from someone who's asking, how helpful or important is having a detailed schedule of summer plans, and how far out should I plan? I love this question. I love planning ahead. If you want to type in a few clarifying comments, great. If not, I'm going to answer it the way I think. What I would say is there's a couple ways of scheduling things. I think if you're thinking about a program that's running in, let's say, July or August, you want to check in and find out, like, what's your current status? And can I be kept updated if that status changes, right? So maybe you don't feel comfortable sending your child to a program in late June, but you would consider it in the beginning of August, but you need more information. In terms of if it's a schedule to keep your kids kind of organized and yourself, I would say yes. So I'm working with a lot of families and my patients that I work with, anxious and just are, typical kids who really, kids and adults, do well with the schedule. I've shown many of you my schedule that I put every day that has my times and the tasks. It feels successful to check things off your list. So I would say summer is often a time of loosening a little bit, and that is still fine. But, in my house, we're still going to have times for reading and an outside activity or a physical activity. We're definitely going to have a time for bedtime, even if that time gets shifted a little bit. We don't want it to shift so much that in August we are taking weeks to set it back. In terms of summer, in terms of like what's doable as like a parent in terms of having a schedule and how far to plan out, you have to know yourself a little bit, right? So if you're mapping out your schedule for the summer and it's more impromptu or it's unscheduled times, stuff that's not relying on another program or other people, you might say something like, let me map out like a couple weeks. I'll have this week, the next week, and the week after. And then as I get through the week, I can adjust as I need to, right? So hopefully that answers that question. I think it's a great question. And I have definitely been looking, and there are lots of, I'm a big fan of Pinterest, or even just go to, Google. Like Google template for summer schedule during COVID. You do not need to recreate the wheel here. And just having, you can use a printable schedule. You can just write something on sticky notes and just remove it every day when the task is done. Nothing really needs to be fancy. Dry erase board works well. Chalkboard works well. Um, so so again, someone's saying someone else spoke about bravery practice and worth sharing. I just think bravery practice in general is really helpful. And one of the questions I got was, I'm having my own anxiety as a caregiver or a parent. What can I do? And I think bravery practice is the key here too, right? We don't call it that. Maybe we call it like facing fears or exposures. I think we also do things like being aware of your own emotions. And so being aware of the things that might trigger your anxiety or make you more sort of agitated, and then trying to see what are things that I can't avoid, like this is something I actually have to do, versus this is something I can delegate or co-parent or co-grandparent or aunt, uncle or other caregiver, versus no, this is actually something I'm going to have to get through, and maybe some skills to practice getting through that moment will be helpful. Another question that I had was, this is a really great question. My child wants a play date, and I want her to see her friend, but the parents are very lax about rules, and I'm not really sure how to navigate that. Yeah, I think I'll start by validating that this is very uncharted territory and can be very uncomfortable. And at the same time, if you just send your child, let's say to the neighbor, let's say it's the neighbor, to the neighbor's house, because you want your child to see the neighbor, let's say outside in the backyard, or the parent saying you can come in the house, but you don't feel comfortable with that, and you just let your child go, you're going to just hold on to a lot of anxiety and uncomfortable feelings. If you completely say no, you might lead to you feeling like you're not allowing your child to experience their friendship. So there's probably room for a middle path here, which is going to involve what this person was saying, bravery practice, right? Having a conversation with someone else about something that makes you feel uncomfortable is just, let's face it, really hard. And so it might be that, let's say the neighbor calls up and says, "Hey, we've been quarantining for 8 weeks and we're doing great, but we'd love to have your daughter Jenny over. Why don't you send her over to play?" And you're thinking, "Oh, yeah, I don't know about that. Like, I don't really feel comfortable with that. I just feel comfortable about playing in the yard," right? So maybe you actually feel comfortable with a yard play date or an open space play date, but not an in someone's house play date. And so, as hard as it is, having a phone call or even a text or an email that says, "Travis, thank you so much for inviting Jenny over. She misses Susie so much. And it's really nice that you are inviting us into the house. We're actually still practicing social distancing right now, so we would love to have a play date outside." And if you want to take it a step further, you might even offer an activity that could be fun. That way it kind of makes it a little harder to turn down. Like, actually, I got this, if it's younger kids, got this really fun bubble machine and it would be great for the yard. Or for the older kids, I got this lawn game and it seems like it'll be really fun. Now, the truth is, it's only one side of the situation, right? The other person could have any number of reactions. The person could say, "That's, ridiculous. You're being overly cautious." And yeah, that would probably feel really uncomfortable. And honestly, everybody manages their own family in a different way. I have told my son on many occasions, what you see in another family is what that family does. And sometimes we're going to do the same thing, and sometimes we're not. Maybe someone will be really rude to you. They might actually say, "Well, I think it's okay, but sure, they can play outside." And then you can just say, "Okay, great. That sounds really fun. We'll be there." And so I think there's a way to sort of advocate for what you need and maybe offer a solution, right? And then the truth is that there might be times when you just don't feel comfortable. And I think that's something that, again, as a parent, you are really allowed to say, "That's really not something we feel comfortable with," or "That sounds great, but not yet." So I really think it's very dependent on your comfort and your ability to sort of navigate that conversation. So I'm going to see if we have any more questions. Oh, so the last question I'll just say, because our time flies when we're having fun. We had a question about my in-laws are thinking we should come and stay with them up in the country or out of the city. I would love to do that, but I'm kind of worried because they don't really understand my child's anxiety disorder. Can you offer any strategies? So this is, navigating your own what we call family of origin, meaning you as an adult have a family, but you belong to a family by history, right? And that is also hard to navigate that sometimes, right? And we actually probably on our website have some tips for like how to talk to grandparents. It's not specific to COVID, but it is specific to like talking to people when they're not maybe speaking the same language. But ultimately, again, you're the parent, right? And so sometimes offering information and a tip is more helpful than just saying, but don't do this. So you might say something like mom and dad, or, um, Bob and Sue, gracious to offer us to come up. And we'd actually really love to do that. We've been working really hard on Jackson's anxiety around going outside. And you'll have to decide. We've been working with a therapist who tells us that, or we've been working on some of our own strategies. And before we come, we'd love to be able to share some of the things we say and do when Jackson's having a hard time or when Jackson is needing some encouragement to go outside. I think when you say it like that, it's hard for someone to say, no, I'm not interested in hearing anything that you say. If they did, you might say, that's really unfortunate. I'm sorry we won't be able to come, right? But if they say, well, I'd love to know more, then you can share with them. And, sometimes grandparents, and I'm not trying to be ageist, but sometimes grandparents have their own experiences from their own childhood. Like, we should just try hard, or you should just buck up and do things and not be scared. And that's where you as a parent can say, absolutely, mom and dad, that's great that you were able to ride a bike without training wheels or sleep in your room without a nightlight. That's something we're still working on. I'm sure you could understand that for a 7-year-old or a 10-year-old or a 4-year-old, that's hard. So I'm going to kind of stop there. I hope that this was helpful. I want to thank you again for joining me. And remember, we're here every day to support you during this extraordinary time. The Childmind Institute is here to help with the mental health and parenting needs during this coronavirus crisis. Please visit us at childmind.org/telehealth to learn more about the incredible variety of remote resources we have. Be safe, and thank you.